Most people don't realize this, but Botox actually comes in a powder form. Most people think that it's a liquid form, but we actually have to turn it into a liquid. And if you can see here, it's a very, very faint powder. All you really can see when you open up a bottle, a package of Botox, is just a very faint white film at the bottom of the bottle. That's the Botox. And we have to suspend it in fluid in order to extract it from the bottle. We get some normal saline, which is what's in this larger container, and we'll take out a milliliter. And then we place it into the Botox bottle. We also use special order insulin syringes with an extremely small fine tip needle, which is much smaller than the recommended size. It's actually a 32 gauge needle, extremely small. The recommended size is 30. The problem with using these needles is that it's extremely fragile. So instead of going through the rubber cap to extract the Botox, we actually take the cap right off. So I'll be taking that off right here. Use a regular bottle opener. You have to be careful. It's a glass rim, so if you're too aggressive, the glass can break. So that's why I'm being really gentle to remove it. But now that's off. And basically you get the saline at the bottom and you kind of stir it around and you're ready to go. So today we're going to be doing a Botox injection around the glabella, which is the frown area, as well as the forehead and what we call the periorbital rhytids or crow's feet. So we're going to do a Botox injection into the three most popular areas for Botox, or Dysport. And I need to talk a little bit about Dysport as well. Dysport is another botulinum toxin like Botox, just a competitor brand. And my personal opinion is they both work about the same. So the first one that we're going to do is the glabella injection, which is an area for the frown. So go ahead and frown for me, Misty. And bottom line is when I have them frown like that, I'm looking for muscle movement. Frown again. And you can see that she really moves all the way from out here. So the Botox injection is going to extend from here to here, and then frown again from here to here on this side. So we're going to start. Standard dose in this area is about 20 units. Some people need more, some people need less. Misty still wanted to have some expression here, so we're giving her a low dose. So instead of the 20, we're only going to give her 15. And then we just hold pressure. Okay, so now we're going to inject the forehead. We're going to do a brow raising pattern to get her by injecting kind of an inverted triangular pattern, which will keep the muscle intact on the sides. And what that will do is it will cause a slight elevation of her brow once the Botox has taken effect. So. Typical doses for the forehead will range anywhere from 10 to 20 units. Again, we're staying light with Misty, so we're only going to give her 10 units today. Now we're going to do a Botox injections around the eyes. This is to reduce the crow's feet or the para-orbital rhytids that you get after sun damage, or it can happen in any face that ages. Go ahead and give me a smile, Misty. She doesn't have a lot. She just has a little bit of, Misty has a little bit of wrinkling here, a small amount of wrinkling right here, and appropriately so, we're just going to give her a small dose here. Typical dose of Botox around these areas is around 10 units per side, but for Misty today, given that she really doesn't have a lot of wrinkling, we're going to just give her 7.5. So again, big smile again. Okay, relax. The one up high is also to help with the brow elevation as well. And then, so when we inject the wrinkle, the muscle responsible for causing these wrinkles is the orbicularis muscle. And this muscle is very superficial. It's directly underneath the skin. And the skin itself is very thin around the eyes. So as you can see here, I'm doing a very superficial injection to the point where I'm raising what's called a wheel, just to ensure that we get the Botox into the muscle. And that's it.